Assignment for a normal psychology 14. I'm here to share some information with you about dissociative identity disorder. What is dissociative identity disorder? It's normally, commonly known as DID or DID, formerly known as multiple personality disorder. Uh, Up until about 1994, when it was given its current name, Dissociative Identity Disorder, which better reflects the condition. It is frequently found in an aftermath of a traumatic event, but this is a rare condition, and most of the victims are most and most and most often the victims are, and most often these individuals are victims of some serious abuse. In defining what associative dissociative identity disorder is, the DMS-5 says that the DID is a severe condition in which two or more distinct entities or personality states are present in and alternatingly taking control over an individual. Some people describe this as the experience of possession. The person also experiences memory loss that is far too extensive to explain as ordinary forgetfulness. And the disorder is characterized by identifying identity fragmentation or splitting, or rather than proliferating a separate personality. So the diagnostic criteria for dissociative identity disorder first would be a disruption in identity characterized as two or more distinct personalities, as we stated earlier. The reoccurring gaps of everyday events, uh, important information, uh, traumatic events, gaps in memory loss. Um, Distress and impairment on, obviously, on your social interactions, work and vocation, and other areas of function. It's a disturbance in the normal part of the broadly accepted culture, ideas, and practices, and religious practices. And the symptom is caused by any kind of substance use disorder or medical condition. So the prevalency of the prevalency rate of dissociative identity disorder is 1.6% in all of the adult population. And for males, it's 1.5%, and it's broken down to 1.4% for females. So there are differential diagnoses that are definitely associated with dissociative identity disorder. Major depression being number one, bipolar disorder, post-traumatic stress disorder, psychotic disorder, disturbance. We have substance and medication-induced disorder, personality disorder, conversion disorder, seizure disorder, factitious disorder, and malingering. Treatment. Treatment for it is obviously the most effective is psychotherapy. And they use a little exposure therapy in there where they bring up they locate the signs of the traumatic event, which causes the dissociative identity disorder in the first place, and deal with fixing that to bring the identities together. The cognitive behavior therapy is definitely used, hypnosis, things like that to bring the recall of the different personality individuals. And the whole goal is to make them one again. Self-help is definitely a plus in the treatment plan. Support groups. There's many support groups with other individuals who suffer from dissociative identity disorder, as well as some online forums and things like that that have become helpful. But medication in this is really not effective for this disorder. However, some people are on psychotic medications, but a person with dissociative identity disorder who is on psychotic medications has to be monitored very closely by a physician. In recapping, uh, associative identity disorder, diagnosis is first and foremost. Get help, seek doctors, treatment, tests. I mean, tests, find out what's wrong, and that's the first line of defense for identity disorder. Secondly, just once you get informed, do the research. There's plenty of movies, books, studies, organizations out there to help people who are suffering from this disorder. And then finally get into treatment, with a trained professional who is focused on unifying personalities in an individual who's suffering from dissociative identity disorder. And once again, finally, find the support that you need to maintain a healthy life, whether that is being with other people who suffer from dissociative identity disorder, organizations, family groups, things like that. I hope this information has been informative for you. I hope it helps you understand a little bit more about dissociative identity disorder. If anyone that you know that may be suffering from social identity disorder, please direct them to the nearest healthcare and psychiatric facility. Once again, my name is Ron Hudson, and this has been associative identity disorder.